surgery is no longer just for Hollywood celebs and wealthy trophy wives. With popular shows like Extreme Makeover, now more Americans are getting interested in having surgical procedures to achieve the look that they've always wanted.
Dr. George Marachand of the Bellevue Plastic Surgeons, Inc. says you might be surprised what you don't know about some common plastic surgery procedures. He's joined by Shannon, one of his patients. And Doctor, you're a board-certified plastic surgeon. You say one of the biggest things patients don't know is the difference between plastic and cosmetic surgeons. What's the difference?
Well, just to dispel some myth, we're not called plastic surgeons because we take plastic. But
not there with plastic making things, yeah.
But plastic comes from the Greek word plastikos, which is mold, reshape. So as a plastic surgeon, we are trained in, well, most of the plastic surgeons in this country are trained in general surgery for 5 years and then 2 or 3 years of plastic surgery training. And cosmetic surgeons can be of different backgrounds, can be ENT surgeons, can be dentists, can be dermatologists. Oh. Obviously, they don't have the same basic training.
So they don't have those extra 3 years of training.
Or 3 to 5 years of training. And then they can take a fellowship with one person, you know, for 2-3 months, and then go to some weekend courses or some seminars, and then become so-called cosmetic surgeon.
I don't want to put you on the spot, but that could be dangerous. I mean, if somebody hasn't had that training, right?
It can be.
Yeah.
You know, if you're an ENT surgeon and you stay within, you know, head and neck area, I mean, that's perfectly acceptable because they are trained in that. But once they start doing other things like tummy tucks and other issues,
I heard there was a death in a dentist chair at one point.
A couple of years ago, it was in Seattle. Yeah, it was by oral surgeon, you know, who had a death in his office.
So plastic surgeon, get somebody who knows what they're doing.
Well, the key is that the person, the key question to ask a surgeon when you try to find someone is, do they have privileges in a hospital to do the same procedures they can do in their office? Because in your office you can do anything you want, but the hospital, if your dentist will not credential you doing tummy tucks, but you can do one in your office.
And it's good to have a hospital nearby or to have that option because things can go wrong because there are risks involved, right?
Even with the best surgeons, you know, occasionally you need a hospital as a backup. You know,
you get a good person like yourself, things can go very right, too. That's why Shannon's here. Well, you had a mommy makeover? What's that, a mommy deal?
Yes. Well, after 2 pregnancies, I was very unhappy aesthetically with the way my stomach and hips and pretty much everything from here down
I've heard people call it the muffin top. Is that right?
It was a muffin top, and I started working out. I had worked out for about a year and was complaining to my husband that things weren't shaping up like I wanted. And jokingly, I said, I'm going to go get liposuction. And I started researching it. And he said, well, if it's something you want to do, go ahead. And after seeing a few different surgeons, I just found Dr. Marachand to be qualified.
And you gave her a breast lift, right?
We did a breast lift.
What's a breast lift as compared to?
And liposuction. Yeah. Well, as she said, through pregnancy, eventually, you know, the breast begins to sag. Gravity wins. And,
gravity wins.
And the kids pulling at you, right?
Yeah, I know that too. And so I asked women if they think that when they have a brassiere on, they have enough volume. You know, then we just do a breast lift and not do an augmentation. Sometimes they come in and say, well, I want an augmentation. And they might not need an augmentation. I do augmentations as well, but
sometimes you don't have to pay and have that added to it.
And the added potential risk later on with augmentations. So we just do a breast lift. And
now, speaking of breast lift, let's take a look at some pictures here. We've got a before and after from a breast lift. That really can make a dramatic difference.
Yes.
Gravity loses after you get done, right?
And I use a short scar technique, so there's no scars in the cleavage area or on the lateral chest wall, so a woman can wear a bikini top. It hides the vertical scar very well.
I want to ask Shannon, I mean, a lot of people may be thinking about this. We're going, oh, man, I'm going to be out for a year or two. Or, I mean, what do you actually go through with this? Because you had everything.
Yeah, like I said, from here down.
Right.
Actually, the day of the procedure was a piece of cake, and, you know, you're out. And I woke up that evening, and they give you medication. And for the first couple of weeks, you want to take it easy. You want to make sure you've got a good support system. My husband and my mother were there. And I just walked real gingerly and got my rest. And after a couple of weeks, you really start getting back to normal routines.
So you took out the implants that she had. She was much larger
Correct.
before, did a breast
Correct,
lift with the short scar, and you also, she wanted to get tummy lipo, right? But you decided there was a better option for her?
All right. I didn't think she would be happy with it because she already had some stretched out skin from her pregnancy, and just liposuctioning that would have been appropriate to give her the best result. I knew she would have been back and not happy. So suggested to do a tummy tuck, which is not only taking out excess skin, but also repairing the damage done by pregnancy by tightening the muscles back together in the midline, you know, to give the so-called flat abdomen, flat tummy. And also, I like to contour the back sections as well.
You can tell the dramatic difference. So you happy, Shannon?
Yes, that's not me.
That's
I know that.
That's not a patient, but
That's not me.
That's not me.
that's another of my patients.
Yeah, but you're happy with it?
I got to tell you, before I could wear a bikini, I shouldn't have worn a bikini. Stretch marks and loose skin, all the stretch marks are gone. The
Oh.
scarring I have is concealed under a bikini line. My stomach has that nice V. I have the hourglass shape I once had, and I'm thrilled.
What's that I hear? Oh, that's your husband going, woohoo!
Yeah, he does do that.
Yeah, I bet he does. Thanks for being with us.
Thank
We'll
you.
be right back.